Welcome to this explainer. Today, we're diving into something absolutely fascinating: the life-saving diagnostic cheat codes that doctors use to make those critical, split-second decisions on the hospital floor. You know, if you've ever wondered how on earth medical professionals can just walk into an emergency room, glance at a totally chaotic mix of symptoms, and instantly pinpoint what's wrong with a patient, well, you are in the exact right place. We're going to be decoding the signs that literally save lives.
So in the high-stakes world of medicine, the number 3 is absolute magic. It's not just a random coincidence. It is actually the foundational pillar of rapid diagnosis.
But what does this actually mean in practice? Well, a medical triad is a very specific group of 3 signs or symptoms that, when they happen together, perfectly characterize a particular disease. When a doctor sees these 3 specific things happening at the exact same time, it cuts right through all the medical noise. It instantly knocks out dozens of other possibilities and tells them exactly what condition they're dealing with. It's basically a biological fingerprint.
To see how this works, we're going to run some fast-paced medical rounds using an incredibly dense study guide of 50 high-yield triads from Medico Info 1. We're going to see exactly how this pattern recognition plays out in the real world, relying on these proven symptom groupings to totally decode the human body.
To keep this massive list manageable, we've organized these triads just like hospital wards. We'll start with the magic of triads, move into cardio and respiratory crises, then neurological and brain disorders, gastrointestinal and renal conditions, systemic and infectious diseases, and wrap up with diagnostic cheat codes mastered.
All right, cardio and respiratory crises. Let's start our rounds right here in this ward, where every single second counts, and recognizing a pattern fast is quite literally the difference between life and death.
First up is a highly lethal condition called cardiac tamponade, and it's instantly recognized by Beck's triad. If a patient presents with hypotension, which is dangerously low blood pressure, along with jugular venous distension, meaning their neck veins are visibly bulging out, and their heart sounds are strangely muffled when you listen with a stethoscope, you don't need to run a dozen tests. That specific triad tells you fluid is actively crushing the heart, and you have to act immediately.
This brilliantly illustrates how triads cluster these related conditions together. Other vital cardiac cheat codes include Virchow's triad, which outlines the 3 distinct factors for blood clotting: endothelial injury, hypercoagulability, and stasis. Then there are the classic signs of aortic stenosis, hitting you with angina, fainting, and heart failure. You'll also see hypertrophic cardiomyopathy flagged by dyspnea, chest pain, and fainting, plus acute pericarditis, which brings pleuritic chest pain, a pericardial friction rub, and diffuse ST elevation on an ECG.
Now, switching gears to the respiratory side of the chest, a deadly pulmonary embolism is quickly flagged by a terrifying triad of its own: hemoptysis, which is coughing up blood, dyspnea or severe shortness of breath, and pleuritic chest pain. If a patient checks all 3 of those boxes, doctors know for sure there's likely a clot in the lungs.
Moving right along to neurological and brain disorders, we're stepping into the neurology ward now, where the brain's warning signals are definitely a bit more complex and subtle, but highly structured.
Think about it. The brain is encased in a rigid skull, which means pressure is its absolute biggest enemy. If a patient has dangerously high pressure inside their skull, you have to watch out for Cushing's triad. It presents as a very specific physiological rebellion: hypertension with a wide pulse pressure, a slow heart rate called bradycardia, and irregular respirations. When the brain is being squeezed like that, it forces the body into this exact 3-part distress signal.
Okay, now we have to be incredibly careful here, because we're looking at a classic medical trap. As our source material points out, there are actually 2 completely different Charcot's triads. There's the Charcot Neurologic Triad for multiple sclerosis in the brain, which gives you an intention tremor, nystagmus, and scanning speech. But then, completely separately, there is another Charcot's triad for cholangitis in the gut, presenting as right upper quadrant pain, fever, and jaundice. Exact same name, totally different body systems.
Let's look at a few other rapid-fire neurocodes. Wernicke's triad alerts us to brain damage through confusion, oculomotor dysfunction, and ataxia. Then, of course, there's the classic meningitis triad: fever, neck stiffness, and an altered mental status. We've also got Guillain-Barré syndrome, which is decoded by ascending weakness, areflexia, and high CSF protein with normal white blood cells. These rigid groupings show you exactly how symptoms build an instant diagnostic picture.
Next up, gastrointestinal and renal conditions. We're rounding on these patients to see exactly how their filtering and processing organs signal profound distress.
So remember that Charcot's triad for cholangitis we just talked about, the gut one? Well, if that condition gets severe enough, it actually breaks the triad rule. It upgrades into Reynolds pentad. You keep the original 3, right upper quadrant pain, fever, and jaundice. But then it tacks on hypotension and an altered mental status for a grand total of 5 critical symptoms. When the triad becomes a pentad, you know the patient is in severe shock.
Deeper in the GI tract, these groupings diagnose some incredibly diverse issues. You can spot a ruptured esophagus using Mackler's triad, combining vomiting, lower chest pain, and subcutaneous emphysema. Or diagnose portal hypertension by spotting ascites, esophageal varices, and splenomegaly. We even have the chronic triad for celiac disease, diarrhea, weight loss, and iron deficiency anemia, right alongside the acute, sudden emergency of mesenteric ischemia, marked by severe abdominal pain, nausea or vomiting, and diarrhea.
Down in the kidneys, triads clearly differentiate conditions that sound super similar but act completely differently. Nephrotic syndrome is protein basically spilling out, shown by proteinuria, hypoalbuminemia, and edema. Hemolytic uremic syndrome, or HUS, presents as hemolytic anemia, thrombocytopenia, and acute renal failure. Meanwhile, acute interstitial nephritis throws a completely different curveball at you with a fever, a rash, and eosinophilia. The rule of 3 really keeps them all straight. Finally, systemic and infectious diseases. This is the ward where we deal with conditions that refuse to stay in just one organ. Their symptoms spread across the entire body. Systemic issues often present super clearly in 3s, showing us just how interconnected our bodies are. Look at reactive arthritis. It hits the urethra, the eyes, and the joints. Or rheumatic fever, triggering migratory arthritis, carditis in the heart, and chorea. Gout is identified by monoarthritis, hyperuricemia, and tophi. And we can't forget the incredibly dangerous blood sugar and acid levels in DKA, or diabetic ketoacidosis, which is perfectly captured by hyperglycemia, metabolic acidosis, and ketosis.
You can also spot distinct infections and severe disorders from a mile away using these rigid patterns. Lyme disease announces itself with erythema migrans, facial palsy, and meningitis. Tetanus basically locks the body down with trismus, facial spasm, and muscle rigidity. We even spot severe blood disorders here, like the CRAB core triad for multiple myeloma, hypercalcemia, renal failure, and anemia, or TTP, which presents with hemolytic anemia, thrombocytopenia, and neurologic symptoms.
And that brings us to Diagnostic Cheat Codes Mastered. We have officially completed our fast-paced rounds of these vital medical triads, traveling from the heart, up to the brain, down through the gut, and across the entire systemic network.
So, the big takeaway here is this. What looks like a chaotic list of rote memorization is actually a perfectly organized, highly elegant system. These patterns prove that medical science isn't just about trying to know every single random fact, it's about knowing how things connect. These triads are the ultimate cheat codes that help medical professionals cut through the noise, recognize the pattern, and literally save lives every single day. Honestly, this kind of pattern recognition is one of the most fascinating aspects of human biology. So the next time you're feeling a bit under the weather, put on your medical detective hat for a second. Pay attention to the patterns. Ask yourself, what will your 3 symptoms reveal? Thanks so much for joining me on this explainer, and keep decoding the world around you.